Who knew that dude was a senator? The public option is back, and like Frankenstein, no matter how much its critics try, they just can't seem to kill it. Welcome, everybody. I'm Neil Cavitto, and despite two failed attempts to push the public option through today, now word that the public option is still very much an option. Senator Tom Harkin quoted as saying that he feels comfortable the Democrats have the 60 votes to pass it in the Senate, even if it means breaking a filibuster. To Maine Democratic Congresswoman Chellie Pingree, who says this ain't dead yet, and not by a long shot. Congresswoman, would you vote for a package that did not include a public option?
Well, I'm very much hoping that I don't have to. I'm in the House, and we are still strongly negotiating in favor of a public option. And frankly, I would have a hard time explaining to my constituents how the economics of health care is going to work. And this major health care reform package is going to come together if we don't have a public option. That's the way I look at it.
All right. Well, ma'am, in the Senate, it looks like it won't be an option. But again, you're quite right to point out in the House a very different set of priorities. Now, if the final measure in the House, where you are, comes and it doesn't include a public option, would you vote against it?
Right now, I wouldn't. It would have to look pretty darn good with a whole bunch of other things that actually make the economics of it work. Right now, I'm not planning to vote for a bill that doesn't have a public option. I mean, honestly, I come from the state of Maine. We're down to just about one insurance company. The public support for a public option is very high in my state. In fact, a recent poll of doctors showed that almost 50% of our medical profession wants a single payer plan. To a lot of people, the public option is already shifting to the right. So for me, it's making sure this really works, and I don't see how we make it work if we don't have some way to introduce competition into the mix.
So you're confident that your constituents and that those in Maine in general would prefer a public option, because your senator could be a swing senator in this. Olympia Snowe is not so sure. Could you update us on that?
Well, that's true. And, you know, Olympia is doing an incredible job trying to negotiate a good plan, keeping the people of Maine in mind. But honestly, I can't speak for the Senate. And what goes on there and what she decides in the final bill is really up to her. But I can tell you, I served 8 years in the state legislature. My daughter's the Speaker of the House. Our state legislator has tried every possible kind of insurance reform, a lot of the things that are being talked about, and it still hasn't brought down prices. It hasn't been what we needed to make sure that everybody in our state was covered. And I can tell you, when I go home on the weekends, small business owners, the insured, the uninsured, what they say to me is, move this forward, get it done, and bring down the costs. And I look at all the different ways of doing it and the things that we've done in our state when we've tried to go it alone without federal help. I just don't see how we do it without bringing down the costs, you know, more like Medicare, where we've really reduced the administrative costs of the insurance package without all the profits and high CEO salaries that are there with insurance companies.
But that seems to be betting that a public option is going to be a lot more efficient. There's very little in our past to indicate that that would be the case. Are you just going on a Hail Mary pass that this will be?
You know, you look at the overhead costs of Medicare right now, which most seniors I know are pretty happy with. Doctors wish that their reimbursement rates were a little higher, but that's about 5 or 6% administrative costs, where the administrative costs of insurance companies today are anywhere between 20 and 30%.
Yeah, but the president himself says, Congresswoman, that Medicare is going to go broke in 10 years, so that's a hell of an example, isn't it?
Well, look, I think this country is going to go broke, and a lot of small businesses are going to go broke if we don't do something about the rising cost of health care going up much faster than wages in this country, and making a lot of our big businesses very uncompetitive. You know, we're the only Western nation that hasn't done something to bring down costs, and all these other things that states have tried, and that frankly some of these other bills are suggesting won't do enough to really bring down the costs. That's what we're here to talk about, to make this work.
Congresswoman, a pleasure. Thank you very, very much.
Thank you.